Welcome to Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Hello, my name is Jason Edwards, and this is Doc Discussions. I'm excited to have a special guest. This is my good friend, Dr. Michael Ogawa. Mike is a medical oncologist, which means he treats patients with chemotherapy and immunotherapy and targeted therapy for cancer. And before we start, I just want to say, Mike, when I think about him, he's such a hard worker, a very smart guy, but a very kind and upbeat person. And I think all the people who work with you very much appreciate your personality. And I know our mutual patients do too. So Mike, welcome.
Thank you. Thanks for having me. And thank you for the very generous and very flattering introduction. So thank you.
Yeah, I try to flatter you to kind of get you off balance, and then we can really hit you here.
It's okay. It works.
And so, Mike, you're from Texas originally, right?
Yes, originally from Dallas. I grew up in one of the northeastern suburbs of Dallas called Garland, Texas.
Okay.
Kind of a small, immigrant population there. So my parents are originally from, my dad was from Japan and my mom was from Vietnam. And my dad actually moved to Texas for work. So that's kind of how they ended up there. But I grew up there and lived most of my life actually in Dallas. Yeah.
How about that? And that explains the big hair.
Right? Yeah, the big hair. You know, I don't have a cowboy hat, but I do have some cowboy boots.
Yeah. They always say the girls in Dallas have big hair. I don't know if that's probably changed since the 80s, but anyway.
I know. Maybe now more of the guys have perms. So.
Yeah. And then you did your undergraduate here in St. Louis at Washington University. Is that right?
That's correct. So I did my undergrad here at Washington University, and so I kind of had a good group of friends here. I ended up going back to Texas for medical school.
Okay.
I went to Texas A&M. It was actually one of the cheapest medical schools I could go to, right around $20,000 a year. It was great.
Very good.
So went there for 4 years, and then I still had some friends here in St. Louis, and I did like St. Louis a lot. So I came back up here for residency, actually, at St. Louis University.
Yeah.
My wife moved up from Texas to kind of be with me, and she's a lawyer, so she took the Missouri bar. And then she was like, I'm not taking another bar exam, so we ended up staying here. 10 years later, we have a daughter, we have a house here, and so I've been here ever since.
Yeah. And you also did part of your training with Dr. Mira Rana, who's our other medical oncologist.
That's right. So she and I go back pretty far. So she and I met actually the first day of residency. So we've known each other for 8-9 years now. And so she went off to Wake Forest for a fellowship, but her husband and her family live here in St. Louis, so we were very happy to have her back actually after that was done.
Yeah. We were. I think you helped recruit her here, and so we're also indebted to you for that.
Oh no, she's definitely a welcome addition to the group.
Yeah,
so, yeah.
So you mentioned your wife and your new young daughter, who is she 2 now?
Yeah, that's a good memory. She's 2.5 years old. And she's really coming into a fun age. It's exciting. There's a lot of fun new things that get to experience every day, both her and myself. So it's been kind of interesting to both kind of navigate that, but also it's been probably one of the most enjoyable times I've had in my life.
That's beautiful.
It's been good.
Yeah, you learn a lot from your kids. You learn a lot about life through kind of living it on the other side of the lens as a parent, for sure.
Yeah, very much so. It's kind of interesting. I guess you can't see through the podcast, but I actually was recently injured. Right, I broke my ankle and I had surgery, and so I think that the same thing when it comes through with children, it kind of gives you a new perspective on kind of life. I think you kind of get into the grind and you get used to a certain routine. And so kind of when you see the novelty in the way your kids see things, it kind of brings excitement to your life. And the same thing, being on the other side of things, like being a patient also kind of wakes you up to kind of the things that they have to deal with every day, and it kind of gives you a new perspective on coming to the hospital and healthcare.
I totally agree. My experience as being a patient was maybe 5 years ago. I was having heart palpitations, and I called Craig Reese, our chief of cardiology, and he said, well, maybe come on in and get checked out. And I was actually worried, it's your heart. And I thought, I'm a pretty healthy guy, but this can happen to anybody. And when Dr. Reese was in the emergency department with me, just you could tell he was a very competent physician, and that and his kind of command of the situation very much put me at ease. And I feel like I became a better doctor for that. What did you learn through your medical experience?
I think that I definitely have the same, I think, level of like fear, anxiety, and almost helplessness. I think that a lot of patients have when they come to see me. I think as medical and radiation oncologists, we never meet people on their best day. All right. So, I think people coming to see me are always worried about things. And even if they're not coming for a cancer diagnosis, when they walk in the doors and it says, Blood and Cancer Center, that's something that is definitely at the forefront of their mind. It's something they're worried about. And the same thing with me too. I think, when I broke my ankle, I was really worried about kind of what would happen, not just in the short term as far as healing and the surgery, but long term, like what would that look like for me, moving forward. And I actually had a very similar experience with you as when I came to the hospital here. Actually, I had my surgery here at St. Luke's. I was not familiar with the surgery department very very much, but everyone was so nice. It was a very kind of welcoming environment, and actually people who I had shared patients with came by and kind of wished me good luck on the surgery. People I've actually never met before. Wanted to come by and just say hi, and it was really nice. It took my mind off of the upcoming surgery, and it made me also feel confident that the patients that we send to get procedures done are in really good hands.
Yeah, I agree. When you're afraid, it's nice to see some friendly faces. It's nice to see some people who are in control and they know what they're doing. And I agree with you as well. It made me more confident in being a St. Luke's physician. Now, the Larry King question here is, what kind of dance move were you trying to do when you broke your ankle?
Obviously not a good dance move. I think that I am a very enthusiastic dancer. I probably enjoy it. I guess my enthusiasm outweighs my skill, put it that way, right? And so I think my wife not so kindly reminded me that I'm not as young as I used to be, and that you can be more careful. But I don't particularly remember the dance move, but I do remember slipping, and and so although I did end up breaking my ankle, it was a very memorable and fun wedding. No regrets.
Yeah, I don't like your wife's negativity, and I think you still got it. So
well,
tell her
you.
I said that.
Thank you. I do have a spare leg, so I can still dance a little bit. It's pretty good though.
Yeah. And there's this is another kind of tenet of life is there's always adversity. There's always, it's going to come in different forms. It's going to come at different times. I think sometimes when it's through a fault of our own, whether it's break your ankle while dancing or getting into a car wreck, it's sometimes harder to accept. But the first step is really acceptance and saying, hey, this is where I'm at. And I've got to objectively find a way to kind of move forward from here. Whether it's a broken bone or a cancer diagnosis, you've got to regroup and say, okay, how do we move forward objectively to optimize our situation?
Yeah. And I agree with that. I think that I definitely experienced some of that, in the beginning, because it was something that was silly and possibly could have been prevented, right? And, in the 2 weeks I was laying on the couch recovering from surgery, I definitely had time to mull that over. And I kept going back and forth between being, saying the same thing that you're saying, like, hey, it happens, you got to accept this. It is what it is, and we can move forward from this. But also, how could this happen? This is, never a good time for something like this to happen. And, it's a busy time at work. It's tough. I'm out. It's a busy time for my family. It's hard for my wife, my daughter. But, I think we kind of tell our patients the same thing, right? Hey, this is something that's unexpected. This is something that's new for you, but this is something that we see a lot, and this is something that we can definitely get you through, right? And so, we allow them to process it, but definitely after, they've come to terms with the diagnosis, it's something that we would love to help push back on, right? It's time for us to fight back against the cancer. It's time for us to kind of get you back to do the things that you like to do, right? And I think that that's really the benefit of modern medicine, even for diseases where we can't cure it. If we can get you back to doing the things that you like to do and getting back to a fairly normal life, I think that we've been successful in what we can do. And I tell my patients, there are lots of diseases where right now there isn't a cure, but every time that there's a conference that comes out or there's new data that comes out, I know it's a happy day for people, right? Because that just means that we just need to get you to the next good drug out there, the next good treatment. And then we start seeing cancer less as a terminal diagnosis, but more of a diagnosis that we can manage long-term, like diabetes or high blood pressure. And I think that takes some of the fear and some of the control away from the diagnosis itself.
Yeah. So when somebody comes into our office, whether it's mine or yours, the first rule is to always be completely honest. Or you could say, always tell the truth and never tell a lie. And those are two different things. And so we're honest with the patient, but part of being honest is to not say, hey, the clinical trial that shows the best treatment for your disease, which is the treatment we're going to do, which we call the standard of care, shows that patients' 5-year overall survival, meaning the amount of patients who are alive 5 years later, whether it was from a cancer or a car wreck or whatever it may be, is this number, say 75%. But that's just the known knowns. Mm-hmm. So like Nassim Nicholas Taleb would say, there are also unknown unknowns and there are known unknowns. Mm-hmm. And the unknown unknown, I guess it's a known unknown, is that there has been continued advancements in each disease site and the cure rate of every cancer over time. And that will likely continue, and maybe even during the course of your treatment, and that itself may prolong your life. And it's an exciting time because you have this not only new systemic therapies that you use with your patients, but there's like new classes of systemic therapies. So like whole new families of systemic therapies. Immune therapies were kind of the big thing maybe 10 years ago and continue to be a big deal. But that's been an exciting time to be an exciting but difficult time to be a medical oncologist because the amount of drugs you need to know it has expanded exponentially.
And I would definitely agree with that. I think that like for a while, the way we treated cancers hadn't changed for 30 to 40 years. And then now really over the last 5 to 10 years, we're starting to see a lot of new drugs come to the market and a lot of new research coming to the forefront, which is really exciting. And I think that, as doctors, we never like to say we're wrong, but I do say that the thing that I'm happiest that I'm wrong about is sometimes when I meet patients and they always ask, so, hey doc, how long do I have? What does this look like? And I find that I'm becoming more and more wrong when I give them an answer based on the historical numbers that we've seen over the last 20, 30 years, right? A lot of the survival data we have is based off this national SEER database. And some of those outcomes that we see there are now being eclipsed by the new data. So when I tell someone, oh, hey, on average, people have 9 months to live with this diagnosis, these patients are now pushing 2-3 years. And then it used to be that these were the outliers. And now we're moving more toward where this is the median. This is what we see on average, that people are living longer and longer. Not necessarily just because the cancer care is better, but our supportive care medicines are a lot better. People are able to tolerate treatments a lot better. And the hospital care is a lot better when people do get into problems, Yeah. So, I think that there's a lot of things that we do here at St. Luke's that make kind of move us inches at a time, but move us along toward getting people to have better outcomes and longer periods of cancer-free remission, like we do tumor board all the time, where, you, myself, the other medical oncologists, the surgeons are there, the radiologists are there, the pathologists are there. And, we have 20 doctors in a room and just talking and kind of thinking about the case and looking at it under a new light. And I think that it gives patients opportunities to have different opinions about their treatment and their care, and it might open, the door to something that even I hadn't thought of alone. So
yeah,
it's been good.
Yeah, I agree. And specifically with oncology, one of the things I really like is that we have doctors at different stages in their career, and I think having that diversity of age can be very beneficial, just because different people kind of have different viewpoints based off different experiences, and it's tumor board is nice, and we get I feel like it's very cordial, and we get along well, and take each other's recommendations into account. And I agree. I think it's brick by brick, inch by inch, every bit of it. Whether it be the supportive care with the nurses in the infusion area or in the hospital, all of it ultimately amounts to better outcomes. And it's nice to be in a state where we're not a steady state, but things are continually improving. And my hope and expectation is that as time goes on, that continues to happen.
Yeah, very much so. And I think that you made a good point. In our group we have, I think, six people who are still practicing medical oncologists, and I would say half of us are in our 30s to 40s, and the other half of us are in our 70s. I think I sit next to Dr. Van Amberg, and he's 77, still going strong, still sharp. And while I bring, I think, optimism and maybe the new cutting edge treatments, he definitely brings a lot of experience to the table, right? He kind of knows how hard to push and how hard not to. And I think that wisdom there is definitely something that you can only gain over years and years of direct patient care and just kind of seeing these things in real life. Also, even at 77, he's still a pro using the computer, so I can't complain at all about using our medical record system or anything. And so he's an encouragement to what I could, see myself doing one day, but definitely having a big mix in both experience, age, and knowledge definitely helps our group a lot.
The other thing I like about St. Luke's Oncology is that we're all busy. We're all not only busy, but very busy. Mm-hmm. And that means that if you see a lot of patients, it's just like anything else in life. It's reps. And so patients aren't reps, but it's more experience. And so if say you're a football player and you run a play in practice 5 times versus 100 times, you are going to understand the nuance of that play a lot better. And so anytime you do something a lot, you figure out how not to do it. And you figure out, why you need to do it this way instead of that way. And I think being busy makes you a better doctor too. Just getting in more reps, more experience. And I know you're a busy doctor, and so is Dr. Rana and Dr. Sokin. But I think that makes people better too.
I think so, and I agree with that. People always ask, people always say, like, you should choose the doctors that your doctors choose, right? And in the same way, like the guy who did the surgery on my leg, he is an ankle guy, so he does lots of ankle surgeries. I was his 3rd ankle surgery of the day, right? And so, yeah. And then I guess is that sentiment where, if you kind of see a lot of different diseases and you see them often, you kind of understand the nuances of how to treat things, and it makes you, as a practitioner, more comfortable with any kind of issues whenever they come up.
Yeah, same with tattoo artists too. If you're going to get a tattoo, you don't want them, like right as they get the needle humming, to say, "Hey, this is my first one. Hopefully it goes well." Right? You want somebody who's like, done a couple thousand.
Maybe a couple more than that. Yeah, for sure.
Mike, you've told me before that your work ethic to some degree comes from your experience with your parents and seeing how hard they work. Can you talk about that a little bit?
Yeah. So my parents, they're immigrants. My dad was born in Japan and my mom was born in Vietnam. And so coming to the United States, I think was definitely a difficult transition for them. But I could definitely see that when they came here, almost everything they did was to help us succeed and us make it in our lifetime. My mom, when she was here, she worked at Pizza Hut for a while, and my dad, he was a janitor. And so to kind of seeing them come up from humble beginnings, and even though they didn't have the same opportunities I had, they worked hard to make sure that I could pursue, not only primary education, but secondary education, and to make sure that was something that I found important in my life, And so, I definitely learned from them that, you just need to kind of have a goal in mind, but also every day, work hard and make sure that, that's something that is always in the forefront of your mind. And it definitely kind of motivates me to know that my successes are not my own necessarily, but they come from, generations of my own family and other people around me working hard to kind of put me in a good place where I have the opportunity to come and learn things that I would never have imagined and help people in ways that I would only dream of before. Yeah.
That's beautiful. And when I think of my own children, I think it's a much better life to try to live your life for something bigger than yourself. And you can look internally, and you can only do that for so long before for most people, it tends to get kind of ugly, but you have the whole universe that you can focus on instead of yourself. And that's actually a much better way to go. Are there, problems out there for sure, but living your life to sacrifice yourself for your family is, as I'm kind of learning over time, is, probably a better way to go. to try to live for ideas or things that are bigger than you. And so when I think about your parents' life, they've worked hard for you and your siblings to do well, and the same with my parents as well. And I used to be kind of like the wide receiver on a football team who would, like, when he would catch a touchdown, he would like pound his chest and say, like, look how great I am. And I feel like I'm transitioning more to a running back where, I'm thinking my offensive line and having a little bit more gratitude around the people who help you get to where you're going, or who took the time when they didn't necessarily need to help you turn this way instead of that way. And sometimes that's just the grain of rice that tips the scale.
Yeah, and I agree with that. I think that, even talking about children, right? I think that the way that sometimes we see success in the media, it's always portrayed as people who are famous or people who are wealthy. And I think financial success is something that people kind of put a lot of weight in. But I think that, just seeing my parents and kind of reframing what they see as a success, I think that their joy doesn't necessarily come from having 2 or 3 cars. It comes from seeing their children successful and happy and comfortable, and they can see that all their years of dedication to help us get where we need to be has paid off. And I think that, I see that now as a goal for myself. I think, people have career goals and career aspirations, but like, I think seeing the way my parents were with me, I put a lot, I guess I try to focus on the goals I have for my own daughter, not necessarily that she needs to have a certain job or be, successful in whatever way she wants, but, to make sure that she is well adjusted and happy and ends up in a place in her life where she feels comfortable and just enjoys that, And I think that that's something that maybe I don't ever see that much emphasized on TV that often, but I think it's something that my parents have kind of shown me is a way to bring happiness even after I'm done working, even after I'm done with everything here. Yeah.
Yeah. Your parents are incredibly wealthy and incredibly successful in that regard, and I think that's the best regard to live life through. And you make a good point. That is not emphasized enough. And it's something that should be venerated. It's something that should be respected. And that's what we want, right? Our children and our community to live the longest life and the best life. The integral happiness curve,
yes,
right? Is
yes.
The mathematician would say. But yeah, and as your parents get wiser as you get older, right? You start looking, okay, maybe Dad was a little bit smarter than I gave him credit for when I was 18.
For sure.
But yeah, and we will be imperfect parents for sure, but the effort will be there. Yeah.
I think I actually looked to you a lot whenever my daughter was born, right? I think as a new father, it was very difficult. Like I wasn't sure. And I think your reassurance and your advice was just like, you take it one day at a time, right? And then when they're young, you just try to keep them alive and it'll be okay, right? Everything will be all right. And I think that idea of just keep looking forward, keep moving forward and do the best you can every day. I think that's probably sage advice for every stage in life.
Yeah, and we're all winging it as parents, right? It's all our first go, so like you're doing the best you can.
That's fair.
One of Mitch Albom's books says, your children are like crystal glasses. You will get fingerprints on them, but don't shatter them. So.
Yeah, I guess I'll tell you how it goes in 18 years. Let you know how good my parenting is. But
give me 35 years, okay?
So that's fair.
All right,
that's fair.
All right, Mike. Well, Mike, I appreciate working with you so much, and I think when I think of you, I think of somebody it's kind of weird, but you're an extremely hard worker, but also have a very good and positive attitude, and you don't always see those two things kind of side by side. But I always love talking to you. You're a dear friend, and I appreciate working with you.
Thank you. And I would definitely like to reciprocate that sentiment you, and that, this is my first job out of training, and I've been here now for 4 years. And, part of my success and part of who I am today, I think, is because of the people around me. And you guys have definitely helped shape the person I've become now and shown me kind of really not only what I need, but what patients need when they come to us in a difficult time, right? So I definitely thank you so much for having me today. And then I do consider you a dear friend. And I really kind of enjoy our both personal and working relationship. And I'm looking forward to more years together.
I couldn't agree more. Thanks so much, Mike.
Join us next time for Doc Discussions with Dr. Jason Edwards. It's medicine for your body, mind, and spirit.